Optimum Medical Solutions have developed this DVD to support you with your training and ongoing development. So why do we need to catheterize someone? There are many reasons why we may need to pass a catheter. The primary purpose is to drain urine from the bladder. The bladder is a muscular organ which is controlled by the pontine micturition center in the brain that controls the muscles which allow the bladder to empty. Any disorder which affects or injures the nerve pathways between the pontine micturition center and the bladder may lead to bladder dysfunction and prevent the bladder from emptying. An obstruction in the urethra, either due to an enlarged prostate gland or a stricture, may also prevent the bladder from emptying fully and may lead to retention of urine. Retention of urine may also occur following a hip replacement, childbirth or pelvic surgery and require catheterization. The bladder may need to be drained during abdominal, pelvic or rectal surgery to protect it from being damaged. Patients requiring immobilization due to fractures may also need to be catheterized. Patients in critical care or following surgery may also be catheterized to monitor their urine output and fluid balance. Some investigations may require a catheter to be inserted. These may include X-rays of the bladder or lower urinary tract, urodynamic studies, obtaining an uncontaminated specimen of urine, or to determine the residual urine if a bladder scanner is not available. A catheter may also need to be passed to instill drugs or chemotherapy directly into the bladder or to irrigate the bladder to remove debris or blood. A catheter may be inserted during end of life to maintain dignity and aid comfort. In certain circumstances, a catheter may be used in intractable incontinence, when other measures have been unsuccessful, and if catheterization will enhance the quality of life for the individual. Care should be taken if you suspect the patient has acute prostatitis or urethral trauma, and advice should be sought. Where patients are showing signs of confusion, a catheter should be used with caution due to the potential risk of the catheter from being pulled out and causing trauma to the urinary tract. Before starting the procedure, it is imperative that as a practitioner, you are up to date with the latest policies relating to best practice and infection control. You must also have an understanding of the anatomy and physiology of the urinary system and show that you are competent to carry out the procedure. A catheter is a hollow tube used to drain fluid from the body. The most common catheters used for indwelling urinary drainage are Foley catheters, named after Frederick Foley, who in 1932 redesigned a catheter with a self-retaining balloon to prevent the catheter from falling out of the bladder. The most widely used catheters are two-way. They are comprised of a hollow cylindrical tube with drainage eyelets, a funnel to attach a drainage bag, and a port in which to inflate the balloon. Catheters are made from a selection of different materials. When choosing a catheter, the following should be taken into consideration: the length of time the catheter is going to be in use, comfort, any history of latex allergy, and past catheter history, for example blocking, incrustation, urinary infections or bladder stones. Commonly used materials are polytetrafluoroethylene, silicone elastomer, hydrogel, and 100% silicone. Latex in its natural form is very flexible and was once used to manufacture catheters, but it can be uncomfortable due to its high friction surface and lead to a high incidence of strictures. To avoid this, latex catheters are coated with one of the following. Polytetrafluoroethylene, commonly known as Teflon, provides a smoother surface, which helps reduce irritation to the urethra. It also reduces incrustation and may be kept in place for up to 4 weeks. Another material used to coat latex is silicone elastomer. The silicone provides a smooth surface, strength and durability, and is shown to reduce encrustation. Hydrogel-coated latex catheters are a popular choice as they absorb water to give a soft, slightly slippery coating, which reduces friction on the urethra. Please note that none of the latex-coated catheters should be used on patients who have a known latex allergy. Catheters produced from 100% silicone are becoming the catheter of choice due to its hypoallergenic properties. As it is uncoated, the lumen of the catheter is slightly larger than other catheters, offering better drainage and reduced risk of incrustation. The Silicone Elastomer, hydrogel-coated and 100% silicone catheters are for long-term use and can be left in place for up to 12 weeks. Foley catheters are available in different lengths. Pediatric, approximately 30 cm in length, female around 23 to 26 cm, and standard length between 40 and 44 cm long. It is imperative that only standard length catheters are used for urethral catheterization in men. Using a shorter catheter can lead to the balloon being inflated in the prostatic bed and cause hemorrhaging. Children and ladies may prefer to use a longer length catheter for comfort. The diameter of a catheter is measured in Charrière, also known as French gauge, where 1 Charrière is equivalent to 1/3 of a millimetre. Therefore, a size 12 catheter is 4 mm in diameter. The Charrière size of the catheter should be written on the catheter and its packaging, and is often abbreviated as FG, FR, F, and sometimes CH. Where the print may have rubbed off over time, the size of catheter can be determined by a universal coloured sizing guide. It is best practice to select the smallest size catheter to enable adequate urinary drainage. In adults, this is most commonly a size 12 or 14 Charrière. The use of larger catheters may cause pain and discomfort and lead to trauma of the urethra. Foley catheters are available with different tips. The most commonly used is a standard round or bullet tip, which is designed to make insertion as easy as possible. A Timon-tipped catheter has a tapered, curved tip. These are designed to negotiate the prostatic curve, but can also be invaluable for commandeering difficult tracts. An open-tipped catheter has the tip of the catheter removed, which helps urinary drainage if there is sediment or debris present, and are sometimes used over a guide wire in difficult catheterizations. In relaxed form, both the male and female urethra are comprised of multiple folds. When passing water, the urethra dilates and becomes more uniform. It is important to follow the manufacturer's instructions in relation to inflating the balloon, as the amount of fluid may vary. Sterile water or glycerine solutions are both suitable for inflating a catheter. Studies have shown using a glycerine solution to inflate a 100% silicone catheter may prevent the balloon from premature deflation. Overfilling of the balloon may lead to the balloon bursting, causing damage to the bladder. Underinflation may lead to occlusion of the eyelets of the catheter, or irritation of the bladder wall, causing the bladder to spasm. Pre-filled syringes are the most convenient way of inflating the balloon. They are sometimes supplied with a catheter, or can be obtained on prescription. 30 ml balloon catheters may be recommended in a hospital setting for hemostasis, and should not be used routinely, as the weight from the balloon places increased pressure on the bladder neck and may cause damage. Cuffing of the balloon can occur once the water has been removed from the balloon. The silicone does not return back to its pre-inflated state, and instead it leaves ridges which cause discomfort on removal. Cuffing can occur in all catheters, but it is most common in 100% silicone catheters due to silicone's poor memory. This can be reduced by using a catheter with an integral balloon. Due to the makeup of the urethra, inserting a catheter can be an uncomfortable and potentially traumatic procedure. Discomfort can be reduced by using a sterile, water-based lubricating gel to reduce friction from the catheter. Some gels, such as Optilube Active, available in 6 ml syringes for female and 11 ml for male urinary tract from Optimum Medical, offer additional benefits. Optilube Active uses a 2% lidocaine solution, which is absorbed into the urethelium, providing local anesthesia. It also includes chlorhexidine, which can be beneficial in protecting against infection during the procedure. For patients where the use of a gel with lidocaine and/or chlorhexidine is not advisable, Optilube, a plain gel without the active ingredients, is also available in 6 ml syringes for female and 11 ml for male urinary tract.